So I just want to extend a warm welcome to the presentation today. And today's presentation concerns the importance of sleep. And I think it's probably something that we can all agree, we do it every night, but we may struggle with it in some way, shape, or form. So that's what we're hoping to work with today is if you are having any sleep difficulties, today's presentation will focus on obviously the importance of sleep and the impacts of getting poor sleep on our health. And we'll do some tips and tricks towards the end to get us on the road to having a better night's sleep. So we'll do that in three parts. The first part is going to cover what sleep is. The second part will focus on sleep deprivation and the consequences of not sleeping as much as we should. And in the last part, that's where we'll discuss those strategies to help us get on the road to a better night's sleep. So today's presentation will be roughly an hour, and we're going to start off by looking at some fun facts about sleep. So with this very large number here, so almost 312,000, might interest you to learn that this is the average number of hours that we spend in bed in a lifetime. So if we live to be just a little shy of 80 years, that's roughly a third of our lives. So it's quite a significant amount of time that we spend asleep. And the way that this number came about was actually the New York Post that came up with this figure. They used an average of just a little bit less than 11 hours a day that we spend in bed. So this is both the time that we spend in there awake and sleeping. Average lifespan, a little bit less than 79 years. Multiply this by 365 days a year, and this is what we get. So it's actually almost half our lives. I used the same calculation with 100 years, and it's almost half our lives, 45 and a quarter years if we live to be 100. So it's quite a lot of time that we do spend in bed. These statistics came from a Statistics Canada study concerning how Canadians sleep. So in 2005, when they collected the first set of statistics, we were averaging about a little over 8 hours of sleep a night. Cut to 2007, when they started collecting the next set of statistics until 2013, and we've actually reduced the amount of sleep we get by over an hour. So it shouldn't come as any surprise then that 1 out of 3 Canadians are not getting the recommended number of hours of rest. I'll give more details later on in the presentation about what that number should look like. What are the recommended number of hours for people based on our age group? And finally, 55% is the number of Canadian women between the ages of 18 and 64 who struggle with falling asleep or staying asleep. And for men, it's around 43%. And these are just some little fun ones, and you can take them away to family members and friends. But on average, it should take us about 10 to 15 minutes to fall asleep. If we fall asleep any quicker than this, it could indicate that we have sleep deprivation. If we fall asleep any slower than this, so if it's taking us a little bit longer, it could mean that maybe we're not quite ready for sleep at night. Marine mammals use only one hemisphere of their brains for sleeping. So for mammals, including humans, we have 2 hemispheres or 2 sides to our brain. For humans, we use both sides when we sleep. And the reason marine mammals only use one is because they need to be able to breathe while they sleep. So they have to be able to surface in the water in order to do that. This fact was really interesting to me. 75% of humans dream in color. And the reason for that has to do with the advent of color television. Whereas prior to this, when we had black and white television, it was more like 75% of us dreamt in black and white. So I thought that was really interesting. Some more animal fun ones. Sea otters, they hold hands with their pod mates when they're asleep so they don't drift away from one another. And we just had the end of daylight savings time. So it might interest you to know that that extra hour of sleep that we do get when we fall back an hour actually reduces the likelihood of getting into a motor vehicle collision. And finally, our sleep improves during a new moon and worsens during a full moon. Scientists aren't clear on the reasons for this. My own personal guess is, and it factors into sleep hygiene, as you'll see later, it's going to be brighter during a full moon. And we don't tend to sleep as well in bright spaces. So anyways, just conjecture. So I hope you enjoyed that. And now we'll get into the rest of the presentation by starting off with what sleep is. And the answer may actually surprise you because it's actually very hard to define what sleep is. And this is because even though it's a state that's common to all of us as humans, we don't actually remember anything that passes during the time that we're asleep. So we don't have a conscious awareness to do that, to remember what happens to us during that mystery period of time when we're sleeping. So what we get in terms of a definition for sleep is the information that we can derive from tests. And basically, we know that we follow a daily pattern of having periods of rest and periods of activity. And that's where these characteristics come from. So for the characteristics of sleep that we use to define sleep, we know that it's a period of reduced activity. We also know that it's a state associated with particular posture. So usually when we sleep at night, we're lying down, we've got our eyes closed. We also know that sleep is a period when we have less reaction to what's going on around us in the environment. So our external stimuli, our responses to that are decreased. We also know and have probably experienced those times when we get woken up. So we know that it's a state that can be easily reversed. And we also know that when we sleep, we undergo a number of physiological changes, so changes in our bodies, one of which is decreased temperature. So when we're starting to fall asleep at night, we also start to cool off. And there's kind of two benefits to this. The first is that it helps to lull us to sleep, having a lowered body temperature. And it also helps us to conserve our energy to have a lower temperature while we sleep. So on average, our temperature decreases by 1 to 2 degrees while we're sleeping at night. And it's lowest during our REM cycles. So I'll talk more shortly about the sleep cycle, and you may be familiar with REM sleep already, but more on that shortly. We also experience a drop in blood pressure during the night. And we have a number of functions that vary, such as our brain waves, our breathing, and our heart rate. And this depends on whether we're awake or whether we're asleep, and also which stage of sleep we're in. Because you'll see that there are some variations even in the ones that I've already mentioned. And sleep is also our chance to rest. So most of the functions that we experience, or physiological changes we experience during the night, tend to decrease. So overall, I mean, our temperature is going down. We know that our blood pressure is down. Our brainwave activity is changing. We've got firings of our neurons that are slowing down during sleep. They're becoming more coordinated. And then we actually see a rise in it. So when I mentioned that there can be some variations on that, so our brain waves can have a little bit of a change in our REM cycle. So again, that's pretty key. The REM cycle seems to be where we have a lot of changes. And we also see the secretion of growth hormones at night. So that's increasing. Our digestion is increasing, as well as our cell repair. And all of these changes, we'll learn a little bit more about why these things happen while we sleep. And again, those sort of factor into the functions of why sleep is beneficial for us. So next we'll look at the sleep cycle. And again, this might be something that you're familiar with already to a certain point, but I just wanted to go through each separate stage. So we do experience 5 separate stages during our sleep at night, and we progress from the first stage to REM sleep, which is stage 5, in progressing cycles. And we actually repeat these cycles throughout the night. So you'll see that there are times associated with each of the stages, how long we spend in each stage. So we don't just start at stage 1 and then, as we sleep, say over the course of 7 or 8 hours, end up in stage 5 and then we wake up. We're actually going 1 to 5 multiple times, such that we spend about 50% of our time, so half our time, is in stage 2 sleep, which you see is quite a light stage of sleep. 20% of our time is in REM sleep, that kind of key one where we're seeing a lot of changes, and 30% would be in the remaining stages, so 1, 3, and 4. Now, in stage 1, as you can see, we spend about 5 to 10 minutes in that stage. We're feeling pretty drowsy at that point, but we're still in a very light state of sleep. So we can be awoken quite easily, and we tend to drift in and out of this stage. So our eye and muscle movements are starting to slow down at this point. And if you've ever experienced that sensation where you're falling, maybe your legs hit the mattress, it happens during this stage of sleep. Stage 2, so that's where we're spending 50% of our time. So this stage lasts about 20 minutes. And our eye movements stop, our brain waves slow. We may experience sleep spindles, which are fluctuations of electrical activity. And then we move on to stage 3, where our brain waves have changed again. So now we're seeing delta waves, and these are an extremely slow form of brainwave. And we still, at that same time, have occasional smaller, faster waves. So as we see, we're progressing, we're getting deeper and deeper into sleep. And then we're at stage 4. And this is where our sleep consists almost exclusively of delta waves. We're not having any eye movement or muscle movement. And if someone were to come and wake us up at stage 4, we're going to feel really groggy. And our last stage, so stage 5, that key one that kind of keeps popping up everywhere, REM or REM or rapid eye movement sleep. It's named as such because our eyes dart around in different directions while we're sleeping. And there are also some other changes. As I mentioned, our heart rate and blood pressure tend to go down at night, but they can actually rise during this stage. And we're experiencing rapid, shallow, and irregular breathing. We also have temporary muscle paralysis in stage 5, and it may interest you to know that this is the stage where we experience dreams. So again, we're having multiple progressions of the sleep cycle throughout the night. So next we'll get into why we need sleep. So we already know that there are some mysteries surrounding sleep, including, the very definition of what sleep is. And it's a fairly similar story for the reasons why we need to sleep. So because we don't really know what happens when we're asleep, it's kind of hard to decipher why we need to sleep. So we have to rely on information, again, that we can get from tests. And we can also make up some theories about why we sleep. One of them is the energy conservation theory. And I mentioned earlier with our temperature dropping at night. So we know that that is helping us to conserve energy. So that's what this theory is based on. So kind of way back when we were competing for limited resources, it was good to have a period during the day when our energy needs and our expenditures were lowered, because this allows us to have more energy available for when we need it, which is during the day when we need to be up and active and going about our chores and our day. So that still rings true for us. And that's one of the reasons why, or one of the theories as to why we need sleep. Another of these theories is the restorative theory. And this theory suggests that sleep is our body's time to heal and restore and rejuvenate itself. And we know that this is true because in animals, if they are left to be sleep deprived, they will die in only a few short weeks because there are just detrimental effects on our immune systems if we aren't getting an adequate rest. And another theory about sleep is related to brain plasticity. So that just refers to how our brain is organized and how this impacts our ability to learn and to form new memories. There is also a link between REM sleep dreaming and cognition meaning our thoughts. So as you can see, there isn't really one single theory as to why we sleep, but each of these theories gives us some insight into the important role that sleep plays in our day-to-day lives, just in terms of helping us with all of those things that we mentioned. So conserving our energy, restoring our immune functions, making new memories. So next we'll look at sleep deprivation, because I think anytime we have a conversation about sleep, we're also acknowledging that there are circumstances where we can have lost sleep, and this can be either on a temporary basis or a chronic basis. So sleep loss occurs when we have a disruption to our sleep. Makes sense? And this can happen to almost anyone, from young infants to older adults. And basically what it means is when our sleep is insufficient to allow us to feel alert, rested, and focused during the day. So when you're thinking of the definition of sleep deprivation, that's what it is. It kind of has to do with our ability to get through our day. So if we're not getting enough sleep at night, we're not going to be able to go about our daily chores as effectively as we would if we got an adequate rest. So the keys are alert, rested, and focused. Now, I mentioned earlier that there's a certain amount of sleep that we should be aiming for. And this has to do with our age. So as you can see, the National Sleep Foundation has some recommended sleep duration times, where anything that's in the orange or peachy colored area, those are not recommended. They're either too few hours or too many hours. So you can't actually have too much of a good thing. The light blue is something, are numbers that may be appropriate. So for some people, they may not need as much sleep as others. On the other hand, some people may need a little bit more than others. So those are ones that might be appropriate for different people. And then finally, the dark blue is going to be where we want to aim for. Those are a recommended number of hours. So looking at young adults and sort of onward, young adults should be aiming for 7 to 9 hours of sleep each night. And they should be getting no fewer than 6 and no more than 10 to 11 on the high end. Adults, so 26 to 64 years of age, should be aiming to get, again, 7 to 9. So that's kind of the good spot right in the middle. 7 to 9 hours of sleep, again, no less than 6, but no more than 10 on the very high end. And finally, older adults, 65 plus, 7 to 8 hours a night, no more than 5 to 6 on the low end, and 9 on the high end. And you'll notice that it steps down as we age. So we need a lot more sleep when we're newborns and infants in comparison to when we're older. And our sleep schedule, so when we're talking about aiming for, let's say, that 7 to 9 hours, this should be done within the 24-hour period of our day. And we call this period our circadian rhythm. So this is just an internal clock, basically, and it's controlled by our brains and our bodies, and it's just based on, it's very, very basic, actually, periods of lightness and darkness in our environment. So we know that when it's dark out, we should be sleeping, and when it's light out is when we have our day and we do our daily tasks. So that's our circadian rhythm. It'll take a little bit of time within that to figure out how much sleep is going to be most appropriate for each individual. So if you find that you are only getting 7 hours of sleep at night, and you wake up, you're not feeling completely rested. Maybe during the day, you're finding that you're fatigued, you're not really as productive as you'd like to be. 7 hours might not be appropriate for you. So playing around with it a little bit and just seeing what would be a good number of hours will take a little bit of trial and error. So now that we've looked at how much sleep we need, we kind of all have an idea in our heads of what works for us and what doesn't work for us. And maybe we had an indication from that graph that we need to play around a little bit more with it. It's good to talk about the factors that do affect our sleep. And the first one on here is mental health. So if we're experiencing stress and anxiety, this can make it really difficult for us to fall asleep or stay asleep. Maybe we find that we're ruminating or we're thinking as we're trying to fall asleep at night, and that works against us a little bit. If we're feeling depressed, we may also notice some changes in our sleep schedules. We might notice that we're sleeping a lot more than we used to, or it's hard to get out of bed. Similarly, we may also notice insomnia. So meaning we're not getting enough rest. Maybe we are keeping odd sleep hours. So mental health can have a big impact on our sleep. Medications, these can also impact our sleep. So for example, steroids or beta blockers, you might be taking these as part of your cardiac medication regimen. Unfortunately, they could be keeping you awake at night. If you are having difficulties with that, it's always good to talk to a doctor or an NP just to see if there are any changes, pharmacists as well. Substances, so nicotine and caffeine, for example, are stimulants, meaning if you take these before you go to sleep, you might actually feel more awake after consuming these products, and this is going to work against you if you're trying to fall asleep. Alcohol, well, it might actually initially help you to fall asleep. Once it has been cleared from your system, it's going to wake you up. So it's good to avoid substances if you can. Diet and meal times, there are some foods, for example, that can promote acid production. This can result in heartburn, might make it uncomfortable to try and fall asleep. Additionally, if you're eating too close to bedtime or eating heavy meals, this can also impact your sleep. Our sleep environment. This is a pretty big one. It has a pretty significant impact on our quality of sleep. If we have a room that's too warm, too bright, or too noisy, this can make you either wake up or make it difficult to get a good night's sleep. Pain can also affect our sleep, so maybe we're finding it hard to fall asleep because we've got some pain. Aging, we saw on the graph that as we age, we actually require less sleep. And finally, shift work, which is any work performed beyond regular 9 to 5 during the daytime hours. So if you're working outside of those hours, this could affect your circadian rhythm and can result in chronic sleep loss or shift work disorder, which is when we have a reversal of the circadian rhythm. So basically, you're tired when you're supposed to be alert, and you have insomnia when you're supposed to be tired, because during those hours of darkness in our day, we should be sleeping, ideally. And the opposite is true for when there's light in our environment. We should be working and getting through our days. So unfortunately, sleep loss can have a lot of detrimental effects on our health and well-being. And this is why it's really important to get a good night's sleep. So when we're sleep deprived, these are some of the effects that we might experience. And you might see a repeat of some of these factors, the first one being mental health. So we saw that mental health can affect our ability to sleep, but on the other hand, our sleep can actually affect our mental health. So sometimes it's a little bit of a trial and error to figure out which one happened first. So we know that stress, anxiety, and depression and feelings of having poor quality of life And a decreased ability to cope with day-to-day stresses are consequences, unfortunately, of poor sleep. Another factor is if we have to make changes to our lifestyle, so lifestyle factors. When we come to the cardiac rehabilitation program, we look at lots of different factors that affect our recovery from a cardiac standpoint. So that includes exercise. We may ask you to make dietary changes, talking about medication changes and things like that. So these are all things that we may find as a result of being fatigued from lack of sleep. We don't really have the energy or the will to want to make these healthy lifestyle changes. So it can work against us if we're not getting a good night's sleep. We also know that if we're not sleeping well, we experience potential weight gain, and this is because we have a compromised ability to regulate the hormones that control our hunger. We're also at an increased risk of developing type 2 diabetes. Looking at risk of infection. So when we looked at those theories about why we sleep, we learned about how in animal models, if an animal is sleep deprived for even just a few short weeks, causes detrimental effects to their immune system, and they unfortunately die. For humans, during our sleep, our bodies produce cytokines, and this helps our bodies to fight infection. So if we're sleep deprived, it's going to take our bodies longer to fight infections. It can open us up to developing chronic illness. So it is very important to get a good night's sleep, especially from that standpoint, if we're recovering from perhaps we've had some stenting, maybe we've had bypass surgery. So it's important to give our bodies that chance to rest and recuperate and to heal. We may also notice as a result of poor sleep that we have a decreased sex drive. So when we lose sleep, we lose energy and interest in sex, and libidos may be decreased. Other effects of poor sleep, so you might notice low productivity, difficulty with focus, feeling sleepy during the day. And I wanted to spend some time on the cardiovascular effects because, again, that's why we all come to the program. And there are quite a number of them. So I think it's great that everybody that is attending the program gets information on that important link between sleep and cardiovascular health. Because unfortunately, the risk is such that if we get poor sleep, higher risk of heart attack, higher risk of hypertension, higher risk of coronary artery disease, as well as an increased risk of death from cardiac diseases and an increased risk of stroke. So there are quite a lot of cardiovascular system effects from poor sleep. Indeed, just losing a single night's sleep can have detrimental effects on the cardiovascular system, such that if you have pre-existing hypertension, so pre-existing high blood pressure, losing that sleep can increase your blood pressure into the following day. Another point for women is if you're sleeping too little or even too much, this has been proven to increase the risk of heart disease. As well, sleep apnea is linked to heart disease. So anyone who suffers from sleep apnea, which are periods in the night where we stop breathing, can experience an increase in their blood pressure each time they awaken during the night. So each time that you have a period where you stop breathing, you wake up, your blood pressure rises. The cumulative effect of this is you develop hypertension. But the good news within that is that if your sleep apnea is treated, it can actually improve your blood pressure. So I think that's a point of hope to be taken from this is even though these consequences are quite unpleasant and we want to avoid them, we can get on our way to avoiding a lot of these effects if we can make some changes. As we saw with hypertension, we get our sleep apnea treated, it can help with that. So I think another important point to look at is when we should call a doctor. So if you notice that you're struggling with sleep more than just occasionally, if you feel tired during the day or you have trouble concentrating, if you notice that you snore or somebody tells you that you snore or that you stop breathing during the night, if you have trouble with tasks that require focus and concentration, and this does include driving, and if you have leg discomfort or twitching that keeps you from falling asleep. So again, these are all reasons to talk to your healthcare practitioner, and they can help you decide if further investigation is needed. And one thing that may be helpful for yourself, as well as your healthcare provider, is to keep a sleep diary. And I'll just bring up a version of a sleep diary here. So this is the National Sleep Foundation's sleep diary. And there are quite a lot available online if you're interested. And some have different levels of detail compared to others. I like this one because it talks a little bit about how to use the diary and the importance of getting sufficient sleep for your health. But it has two different self-assessments. So you're going to do one in the morning and one at the end of the day before you get to sleep at night. So it's 7 days. If you wanted to do maybe a couple weeks and then bring it forward to your healthcare provider, or even just for your own interest, if you want to track how your sleep goes for 1 or 2 weeks, then maybe print a couple of these pages. But you'll start off by writing down the day of the week, and you're going to look at lots of different factors. So when you went to bed at night, when you got out of bed in the morning, how easy or difficult was it for you to fall asleep? How many times did you wake up during the night? And if there were any sleep disturbances, and how that might have made you feel when you woke up. Were you feeling refreshed or were you feeling tired? And then there's room for notes. And then the second one, so you're going to, right before you get into bed at night, you're going to do another self-assessment, and you're going to write down information about all the factors that could impact your sleep. And some of them we've looked at already, and some of them we will be looking at when we look at sleep hygiene. So we talked about caffeine. So did we consume any caffeine? How many? What time of day? Did we exercise, take medications, take a nap? How were you feeling during your day? Were you finding that you were dozing off? And did you have any heavy meals or substances? And then we'll talk about later on in the presentation about a sleep routine, but there's room for what you might include in that as well. So again, that's just one example of a sleep diary. I happen to like this one because of the level of detail. And again, it can be helpful for your own purposes, just to kind of give you some ideas of where to start working on getting a better night's sleep, or you can bring it to the attention of your healthcare provider. All right. So now we'll get into getting a better night's sleep. So again, we know the consequences of sleep deprivation are very unappealing, to say the least. So what are we going to do about our sleep loss in order to prevent it and prevent its devastating consequences? And the first thing that we can do is start with sleep hygiene. So sleep hygiene refers to activities and habits that contribute to a good night's sleep. And these include all of the following. So the first is keeping a consistent schedule, and this includes even on weekends. So for those of you who work during the week, this can be a bit of a challenge, but it is important to try and maintain a consistent schedule throughout the entire week. And this also includes both daytime and bedtime routines. And basically what we're aiming to avoid is, if we find that we have sleep loss, we don't want to feed it by trying to change our plans and activities to accommodate our sleep loss. So this might mean if we didn't sleep well at night, we decide not to go out and do our exercise because we're feeling too tired. And we decide to take a nap. So we want to try and avoid that if at all possible. Another important thing to do is to develop a bedtime routine. So if you don't already have one, this is just a variety of activities that help to cue your body for sleep readiness. So this could involve, maybe you're brushing your teeth, you get into bed, you do some reading, and then maybe you do some meditation or some deep breathing, just as a way to try and lull yourself to sleep. And over time, doing all of this same ritual or developing a routine will help your body, again, feel ready for sleep once you do these activities. Another important thing is to sleep when you're sleepy. So if you get into bed, and I mentioned earlier in the presentation, shouldn't take you any longer than, I say, about 20 minutes. So if you're not asleep after 20 minutes, that's the time that you get up and try again. If you're falling asleep 10 to 15 minutes, that's about average. Shouldn't be any quicker than that. And the reason you want to get up and leave the bedroom and do a calming activity outside of the bedroom is so that you avoid spending excess time awake in bed. So you want to really preserve that sleep space for sleeping, and that will also help to cue your body when you go into the bedroom, get into bed, this is the time to sleep. Sleeping when you're sleepy. Avoiding naps if possible, and this isn't a hard and fast rule. There are circumstances certainly where having a nap is beneficial, and this would certainly fall under, the category of cardiovascular rehabilitation. So I mentioned earlier, bypass surgery and having PCI, where you get stents placed in your arteries. Maybe you need some extra sleep. So I think in those cases, aim to nap before 2 p.m. And the goal is just to minimize any disruptions to your nighttime sleep. So if you're finding that you're, maybe having a 1 hour nap during the day, you're doing it before 2 o'clock, you're still going to bed at night and you're getting that 7 to 9 or 8 hours roughly, then napping isn't an issue. If you find that you're taking longer naps, or maybe you're taking them after 2 p.m. and then your bedtime's starting to creep forward, that's what we don't want to have happen. So there might be some changes that you can make for your sleep hygiene in minimizing the length of your naps or working with different timing of the day. We talked about substance use and how that can affect our sleep. So we know that caffeine, nicotine, these are things that will make us feel more awake. And alcohol can kind of have a half and half effect. And various different drugs and medications can have an impact on our sleep as well. Avoid blue light exposure. So blue light is just a form of brighter light that's emitted by all of our electronic devices. So whether that be our televisions, our tablets, our cell phones. So these things we should aim to turn off at least 1 hour before we go to bed, because this can interfere with our production of melatonin, which is a hormone that helps us for sleep. So we want to avoid blue light exposure if we can. We also want to focus on lifestyle factors that can help us achieve a good sleep. So this includes eating a healthy, balanced diet, getting regular exercise, and taking some time to relax. So this could be an activity that helps you clear your mind, for example, meditation or prayer. And one of the benefits of this is that it helps to manage any stress or anxiety that might be affecting our sleep. Another part of sleep hygiene is the sleep environment. And I mentioned earlier that this was something that was very important. And we saw that having a room that was too bright and too noisy and too warm can negatively impact our sleep. So For our sleep environment, we want to aim to have an area that's cool and dark. We want to have comfortable sleep surfaces, so that includes our pillows, mattresses, and bedding. And it can take a little while to play around if you've ever gone pillow shopping or mattress shopping. And your bedroom should be used for sleep and sex only. Avoid activities that we associate with awakeness. So, for example, working in bed with your laptop, eating, watching TV. So these are all activities that should be avoided. We want to have a good calming space and really preserve the sleeping space for just those activities. So for calm activities. And next we'll look at some relaxation techniques. Now, if you participated in the stress management workshop, you will recognize these two activities. And you'll recall that deep breathing and progressive muscle relaxation are techniques that promote relaxation, especially when we're feeling stressed or overwhelmed. It may interest you, though, to learn that these techniques can also be part of promoting relaxation when it comes to sleep. So we won't go through the examples because we do them in stress management. So just maybe look back in your packages. You've got the sheets in there. But just to recap, you're going to focus on breathing in through your nose and out through the mouth. You can do that 4 to 1 count that's on the sheet where you're breathing in for 4, pausing for 1, out over 4, pausing for 1. You want to really focus that air into your belly so that you get that diaphragmatic breathing. So that's deeper breathing. Whereas, when you're feeling stressed or anxious, you have much more shallow breathing. So that's what we want to avoid. We want to counter that with the deep breathing. If it helps, you can count in your head. So you can count out that 4 to 1 ratio. Adjust the exercise just according to your ability. If you're feeling uncomfortable, shortness of breath, either stop or just adjust. So maybe you aren't breathing in for as long of a count. Or perhaps if you wanted to, on the opposite end, you wanted to hold your breath a little bit longer, that's also something that you can do. But do try to build up to that suggested rate of 4 to 1. And again, the key is just to practice regularly. So that's why it's worth bearing repetition. So if you want to use it as a way to help relax you at night, might be good to either do it outside of the room in a calm space, or when you crawl into bed at night, maybe you aim to do 5 to 10 minutes of deep breathing. And this is what brings your focus to your breath and sort of engages in mindfulness where you're focusing on the present moment. And not so much on the worries and stresses of the day or things that you're anticipating or things that have happened in the past. So that's one relaxation technique that you can use to help with sleep. The next is progressive muscle relaxation. So this, again, you would do either seated or lying comfortably. Protect your head and neck. You're just going to tense and release your muscles in sequence. So again, you can recall those activities, the sheets in your packages for progressive muscle relaxation from the stress management workshop. And you're just going to follow whatever sequence you like. You're going to do 3 repetitions of each muscle group, or you can make some variations if you wish to do so. But you're going to focus on the contrast between those feelings of tension and feelings of relaxation. And just avoid any movements that cause discomfort. And this is helpful for a sleep routine. So again, you can do it outside of the bedroom in a calm area, or you can do it as you're falling asleep at night as a way of bringing your focus to and attention to the present moment. And it's a great way of relaxing yourself and helping with any stress or anxiety that are affecting your sleep. So those are some relaxation techniques you can try. The next technique we're going to look at is guided imagery. And it can be helpful to, again, bring our focus to something else rather than the fact that, maybe we're lying in bed and we're not falling asleep. And we can do this by visualizing a happy place in our heads. So that's what this technique does, is it helps us to form or recall, emotional reactions that we've had to a certain place. And visualizing it in our minds in great detail can be very comforting. And the only thing that we need is imagination. So what you'll want to do is just think of a place you find calming, and this can be almost anywhere. In a lot of the examples, they talk about going to the beach. So a trip to the beach, what do you find if you were to go to a beach? For some people, it might be a camp or recalling a special vacation, or maybe you have that special hiking spot you like to go to. It can be almost any place, but the idea is to just think of somewhere that is calming and somewhere that you associate with happy memories. And then you're going to imagine the sights, sounds, tastes, smells, and sensations of this place. So any detail that you can possibly imagine, just so you can evoke or create that image in your mind. So we'll do an example today, and we're going to do a walk in the woods. So I'll just have you, like you would for progressive muscle relaxation or deep breathing, you can seat yourself comfortably or lie down if you want to cut your video feed, and that's more comfortable for you. And then you're just going to close your eyes, and you're going to picture this walk in your minds, or you can use the image on the screen for guidance. So we're going to start off by taking a few deep breaths. So just have you breathe in and out. Breathe in through the nose, out through the mouth. And one more time, breathe in and out. In your minds, you're going to imagine that you're going for a walk in the woods. You're at home and you're getting ready to step outside. You're looking forward to this walk. The weather outside is mild. You are going to your favorite place to hike. Try and picture that place in your mind. Where is that place for you? And you're happy to have the chance to enjoy that time to connect with nature. You step out of the house and you feel the warmth of the sun on your face. You put on your sunglasses and get in your car. Is someone going with you on your walk? Do you have a pet that's going with you? Are you meeting someone there? The drive is clear and you're thankful that traffic isn't bad. Once you arrive, you get out of the car and you inhale the fresh scent of the air. It smells pleasant. What is the scent? Is it pine? What is the air like? Is it humid? Cool? As you begin your walk, you notice bird calls and the hum of bees going about their work. You notice there is a slight breeze and it keeps you cool. You hear the crunch of branches beneath your feet with each step. You continue your walk, noticing all of the sights and sounds around you. What do you see? Are there others out enjoying the nice weather? You smile as you pass them. Eventually, you sit at one of the benches and take a sip of water. You look up at the sky and see the rays of sun peeking through the canopy of bright green leaves. Though you have enjoyed your walk, you know it's time to head home. And as you walk back to your car, you think to yourself, what a perfect day. I am refreshed, I am calm, and I can come back to this place anytime I want. And we'll finish off by taking 3 more deep breaths. So breathe in through your nose, out through the mouth. Breathe in and out. Breathe in and out. When you're ready, just open your eyes. You can sit back up if you're lying down and just resume your regular breathing. You might find this activity especially beneficial right now, just given the precautions that the pandemic has demanded of all of us. Maybe it meant your vacation plans had to be canceled this summer or even this fall. So at least we can take a little bit of a trip there in our minds and maybe benefit from improved sleep in the meantime. So again, you can use almost any place. The key is just, it should aim to be a calming place associated with good memories, and you want to imagine all of the details. You can also try meditation apps. Some of them do offer some guided imagery, or just guided meditations. And these might include Insight Timer, Calm, or Headspace, or perhaps you've come across another app that you enjoy. And lastly, I'll just make a quick mention about medications and supplements and other alternative therapies. Because occasionally we may use medications or supplements or other therapies to help us sleep. And specifically with medications or supplements, so this might include melatonin, CBD oil, allergy or cold medications, or sleeping pills to help us sleep. I know there's a few others I've seen recently, 5-HTP. These are all things that should be used only under the advisement of your doctor or nurse practitioner, and do so with their supervision. And this would be in order to avoid potentially harmful medication interactions or other harmful side effects. So with being on usually a cardiac regimen, so having a lot of different cardiac medications, it's important to take those medications or other medications for your underlying health issues. But do be mindful that if you are interested in trying any other, as I said, medications or supplements, to talk to your doctor about it. If you feel that you have a breathing problem, so I mentioned sleep apnea earlier, there may be some surgical options or breathing devices available, but this would need to be done after a sleep study. So again, great opportunity to talk to your healthcare provider just about whether or not further investigation is needed. And for issues or dental issues such as teeth grinding, it's good to talk to your dentist. They may even tell you that you have evidence on your teeth of teeth grinding. So they may suggest a dental guard. And just as a completion of today's workshop, I'll do a quick summary of everything that we've learned. So we started off by looking at what sleep is. And we learned that we base our definition on common characteristics of sleep because we don't recall what goes on when we sleep. So we do know that we have that recumbent body posture where we're lying down, our eyes are closed, we have reduced activity and reaction to stimuli in our environment. We also know that there's some physiological changes that we experience during sleep. We also looked at different theories about why sleep is important to us. And we know that it's vital to our day-to-day lives because it helps us to conserve our energy, restore our immune function, helps us to learn as well as make new memories. We also discussed the unfortunate consequences of sleep deprivation and how it can be detrimental to our mental health, as well as our physical health and our well-being. And we know that if we are sleep deprived, there are many non-medical and medical treatments available to us to help us get a good night's sleep. So that's that hopeful point for us. Even though the consequences of sleep deprivation are undesirable and can be, again, detrimental to our health and our well-being, we know that there are lots of different things that we can help to use to treat that. And that's it. So I hope that everybody found this helpful and learned a little technique or two that can help them get on the road to a good night's sleep. So I appreciate everybody joining in today.